Hello everyone, I'm Dr. Meenakshi Dua. I'm Clinical Director at ART Fertility Clinics Gurugram. I have been into practice for more than 18 years now and exclusively into IVF for more than 11-12 years. Today I'll be talking about few of the common questions which generally my patients ask me, the doubts what they have about IVF, and we'll also be busting some myths around IVF. If I talk about risk, mainly there are two risks which we face. One is multiple pregnancy and second is ovarian hyperstimulation syndrome. Multiple pregnancy means having more than one baby at a time. But when we do the embryo transfer, it is mostly in our hand. We can, if we transfer one, you'll have single baby. If we transfer two, you'll have twins. And now, according to the recent guidelines by the government, the ART law 2022, we cannot transfer more than 3 embryos. So more than triplets, patient cannot have. Multiple pregnancy is a complication which can be controlled by us. It is in our hand. Again, now ovarian hyperstimulation, with the latest, I'll say IVF stimulation protocols and the drugs what we have, it is almost negligible. In past, ART is been there from past 2 years now functioning in India, and we have not had single case of ovarian hyperstimulation till now. Our clinic is OHSS free clinic. So with the technology, with the drugs and the protocols, we can actually completely negate that. Now, talking about the side effects of IVF, the common side effects what a patient generally faces is having bloating, little weight gain, mood swings, nausea and vomiting. Rarely they can have, or they can have pain at the site of injection. Otherwise, there are no major side effects. The risk of having genetic disorders in a general population is around 1 to 2%, not more than that. And in IVF, because we are treating women who are elderly, men who are elderly, and they have some baseline problem, the risk increases to 3 to 4%. But so far, no studies have proven that this risk increases due to the technology which is used. It may be because we are dealing with a population who have some problem, who have difficulty in conceiving, and that is why they are facing this. So there is no major risk as such, and we can safely proceed with an IVF cycle. More than one baby, again, it is in our hand how many embryos we transfer. If I transfer one, you will have only one baby, not more than that. So that can be completely controlled. But rarely, in around less than 2% of the cases, when we transfer a blastocyst, it can split inside the womb. And though we have transferred one embryo, a patient can have two. So but the incidence is less than 2, and it is mostly seen in women who are in advanced age, above 35 years of age. If you have any more queries or any doubts regarding IVF procedure or IVF technique, please feel free to contact us on the below mentioned email or the phone, and we are just a call away.